Hello, my name is Dr. Phil Davies. I'm speaking from my practice in Hampshire. This is a message primarily for our practice patients, but can equally apply to patients throughout the UK. As you're all aware, the coronavirus COVID-19 pandemic is about to surge in this country. And so this is a timely message to advise our patients on some management matters. The first thing I'll touch on is how you may avoid getting the virus yourself and transmitting it to other people. Secondly, what you will do should you think you are getting the virus. Then I'll touch on when you may rightly think you need to speak to a medical professional. And then in that situation, when you're speaking to a medical professional on the telephone, what sort of things that medical professional will want to know from you. And so I'll start, first of all, general issues. In order to avoid getting the virus and transmitting it to other people, this social distancing is very, very important. Even for young people. Our practice has a large, young, fit population in large part. It still applies to them. Young people are not immune to this. It's a new virus, and although most people dying at the moment are over 50, there is a substantial number of patients under 40 in the ICU at this moment. You are also capable of passing it on to more vulnerable people who can die more readily. So social distancing, that 2-meter rule minimum, is extremely important, both outside work and in work. In work, if you can't effectively work from home, your employer will try to ensure that that social distance is maintained in the workplace through a variety of measures. After work, you should avoid socializing in groups. That is a good way of getting the virus. You should also avoid alcohol in excess. That will make you vulnerable not only to getting the virus, but probably raising your risk of getting a severe infection. Stressful times and exhaustion will make you more vulnerable to this virus and more vulnerable to a more severe infection. So after work, try to relax, try to eat well, and try to sleep well. If you're not a big consumer of vitamin C, then perhaps this is the time to take an additional chewable vitamin C supplement. There is some mild evidence to see that that would help. You should take regular, moderate physical exercise. That will be good for you. It is probably not the time to take up intense endurance exercise, testing yourself against the clock. That sort of intense, highly strenuous, maintained exercise may well make you slightly more vulnerable or appreciably more vulnerable to this infection. So, what should you do should you think you're getting the virus? Well, the symptoms to look for, I'm sure you're aware, is fever and/or a persistent dry cough. Now, a fever, you may not have a thermometer. So a fever you will know about. You will feel hot, forehead, chest, and you may be sweaty, but you will feel hot. The cough, persistent dry cough, going on for more than an hour, or if in shorter bursts, it will recur more than 3 times in 24 hours. Those are the symptoms classic for this virus. If you just have a bit of nasal congestion or sinus congestion, but no fever at all and no persistent dry cough, it is most unlikely to be coronavirus. So if you think you have got the infection, immediately self-isolate. Stay isolated, and then you can look for more information, either online at the NHS 111 site online, not the phone line, so that's 111.nhs.uk. That gives good information, and you can go through that. You then also inform your employer, and they, if you're in a communal accommodation, they can make arrangements to help you with that, but they also need to know that you're off work. And you will generally be off work for 7 days and return when you're well. If you're part of a family group living together, then it will be 14 days, as I'm sure you already know. So that doesn't mean you need to contact a doctor. That in itself is not required. We don't want to burden the NHS. Lots of people will have those symptoms, and young fit people will mostly have those symptoms and survive fine. But this is a respiratory illness. So if someone worsens, they are likely to become a bit more breathless. Breathing difficulties. If you're having breathing difficulties, that is when you need to speak to a doctor or a healthcare professional. And that means, yes, dialing 111, or during work hours, our practice. Now, we're thinking or proposing to provide 24/7 cover quite soon for all our practice patients. And if that does happen, then we will replace that 111 facility for you. You can still phone 111 if you choose, that's fine, but we will try to provide that service as well. That's not official yet, but that's something that we're looking to try and provide to take the burden off the NHS. So you would be phoning for us, I would think, primarily because you're starting to get breathing difficulties. Then we're interested. So, what are we wanting to know from you when you phone us? Well, we want you to identify yourself. We will also want to establish that you're not so unwell that you've become confused. People can get confused with nasty infections, and so we will check that you're orientated in time, place and person. When we hear you speak, we will like to see if you can speak fluidly in full sentences without having to stop and breathe heavily. We might even make you say a few sentences artificially, get you to say the words of the national anthem, for instance. That gives us an impression of how well you can breathe while you speak. We will want to know more general symptoms, so the dry cough, the fever. Perhaps you have other symptoms as well. Maybe you have a sore throat, maybe you have aching muscles all over, maybe you're extremely tired, maybe you have a headache, maybe you feel nauseated. Those symptoms are useful. You can use it to rule out other things, but also it can be part of the coronavirus picture. But we're primarily homing in on breathlessness. So what next will we want to know? And this is key. There are two indicators that we'll be very interested in: respiratory rate and pulse rate. And we mention it now because I want you guys to get used to taking your respiratory rate and pulse rate at rest when you are well, so that you know those values for when you're well and you're able to do it again when you're unwell. So respiratory rate, you do it at rest. So sitting down in a chair or in the end of the bed with your feet flat on the floor. There's a reason for that. Relax. Don't take this just as soon as you've come running in from playing sport. Relax. Calm yourself for a minute or two. You have to be calm. And then record the number of breaths you take in a minute. Simple. That's fine when you're otherwise well. I'd like you to record what that is. It should be below 20 in a younger, fitter person. There are some people over 65 who may have a value slightly higher than that, but that's why it's just as important for them, if not more so, to actually measure the respiratory rate when they're well, so that they know that. When you're unwell and you're phoning the doctor, you will get anxious because you're worried about what it might be. So ideally, take a few of these readings before you pick up the phone and try to calm yourself down, get to your most calm, so that you can then take the number of breaths you're taking in a minute when you're at your most calm. We are interested when the breathing rate gets above 20, and when it continues to get above 25, we're even more interested. The next value we will be interested in is your pulse rate. You need to be able to take your pulse. So we start with the pulse from the neck, the carotid pulse. It's the strongest pulse in the body, and it's easy to find. You use your first two fingers. You don't use your thumb. Your thumb has a strong pulse in it, and often that's the pulse you're feeling. To take the carotid pulse, the pulse in the neck, you raise your head and feel your windpipe. There's a muscle that runs either side of the neck on both sides, and you have the carotid arteries coming down both sides there. So you feel for the gap between the windpipe and that muscle. And there it is, the pulse in your neck. It's usually quite a strong pulse. We want you to relax yourself and then take your pulse. And I want you to record that before you phone so that you already know what your pulse rate is. You should do that when you're now resting so that you know what your pulse rate is when you're well. We may then ask you to take your pulse at your wrist as well, and that is the radial pulse. And you do that by feeling down the gutter on the thumb side of the wrist, just above the wrist, in a bit of a gutter that comes in from the side of the forearm. Feeling in there, don't press too hard. Use the first two fingers again. Don't press too hard because you can occlude the pulse. Get used to taking your pulse in that way. The reason we're interested in the radial pulse as well as the carotid pulse is that that can give us an idea of what your blood pressure might be. That's useful information for us. So the takeaway from this message is get used to taking your pulses and get used to taking your respiratory rate and know what is a normal value for you so that when you phone us, you have the information ready for us. What is your pulse rate now feeling unwell? What is your respiratory rate now feeling unwell compared to when you were well? That sort of information will help us decide what to do with you, whether to manage you at home or send you to hospital. If you're talking in full sentences quite freely and your respiratory rate's under 20 and your pulse rate's under 100, you're probably staying right where you are. We will follow you up and we will stay in touch from time to time to monitor you, but you're unlikely to need hospital in that situation. Thank you and stay well.